Welcome to Copilot Podcasts. When you think of artificial intelligence, you probably imagine robots and computers. But what if I told you AI is transforming one of the most human-centered forms of healthcare, hospice and palliative care? Today, we're exploring how AI is revolutionizing end-of-life care, from predicting patient needs to enhancing quality of life. By the end of this episode, you'll understand both the incredible potential and profound challenges of bringing artificial intelligence into our most vulnerable moments. And joining us to unpack this fascinating intersection of technology and compassion is our expert in palliative care and AI integration. Welcome.
Thanks for having me. It's really interesting that you mentioned the human aspect because that's actually where AI is making some of its biggest impacts.
Really? How so?
Well, according to recent research from 2024, AI is being used in several key areas of palliative care, from predicting patient mortality to monitoring symptoms and even helping with communication.
That's fascinating. Can you give us some specific examples?
Sure, one of the most significant applications is in remote patient monitoring. AI systems can track vital signs, physical activity, and even medication adherence through various sensors and devices.
Wait, so it's like having a virtual care team watching over patients 24/7?
Exactly. And what's really impressive is the accuracy. A study from 2025 showed that machine learning models achieved areas under the curve of over 0.97 in predicting different phases of palliative care.
Could you break down what that means for our listeners?
Of course. Essentially, it means these AI systems are incredibly accurate at predicting when a patient's condition might change, allowing healthcare teams to respond proactively rather than reactively.
You know what's striking me here? This seems like a huge shift from traditional hospice care, which we typically think of as very hands-on and personal.
That's actually a common misconception. AI isn't replacing the human touch, it's enhancing it. By handling routine monitoring and data analysis, it frees up caregivers to spend more quality time with patients.
Interesting. But surely there must be challenges or concerns.
Absolutely. One major concern is algorithmic bias. Recent studies have shown that some AI systems can perpetuate racial and cultural biases in their responses and recommendations.
That sounds serious. How is the field addressing these issues?
There's a strong focus on ethical AI development. Research from 2025 emphasizes 5 core principles: beneficence, non-maleficence, autonomy, justice, and explicability.
Those are some big words. Can you break them down?
Sure, basically, it means AI should do good, avoid harm, respect patient choices, be fair to everyone, and be able to explain its decisions.
You know what's really striking me here? We're using cutting-edge technology to address one of humanity's most ancient challenges, caring for people at the end of life.
Exactly. And here's a surprising statistic. Americans with cancer are more than twice as likely to be in the ICU in their final months compared to other developed nations.
That's actually quite shocking. How is AI helping address this?
AI systems can help identify patients who might benefit from palliative care earlier, potentially reducing unnecessary ICU stays and improving quality of life.
Let's talk about the practical side. What does this actually look like in day-to-day care?
Well, one example is AI-powered chatbots that provide 24/7 support to families, answering questions and offering guidance when human staff aren't immediately available.
But can a chatbot really handle such sensitive conversations?
That's a valid concern. Current research shows these tools are best used for basic information and support, not replacing crucial end-of-life conversations.
What about the cost aspect? Healthcare can be expensive enough already.
Actually, studies indicate AI can lead to significant cost savings by preventing hospital readmissions and optimizing resource allocation.
That's promising. What other benefits are we seeing?
One fascinating application is in symptom management. AI can detect patterns that might be missed by human observers, leading to better pain control and comfort care.
Can you give us a specific example?
Sure. Recent studies show AI systems can predict risk factors for issues like pressure ulcers in bedbound patients, allowing for preventive measures before problems develop.
That's incredible. It's like having an extra set of eyes watching out for potential problems.
Exactly. And it's particularly valuable in home-based hospice care, where healthcare providers can't be physically present all the time.
Speaking of home care, how are families responding to all this technology?
Research shows mixed reactions. While many appreciate the additional support and monitoring, some worry about privacy and the potential loss of human connection.
Those seem like valid concerns.
They absolutely are. That's why there's such emphasis on using AI as a supplement to, not a replacement for, human care.
Let's talk about the future. Where do you see this technology heading?
Current research suggests we'll see more personalized care plans, with AI analyzing multiple data points to create highly individualized treatment approaches.
That sounds promising. Any other developments on the horizon?
Yes, there's exciting work being done in natural language processing to help detect psychological symptoms and emotional needs that patients might not explicitly express.
Wait, so AI can pick up on emotional cues?
To some extent, it can analyze patterns in language and behavior that might indicate distress or unmet needs.
That's fascinating. What about the healthcare providers themselves? How are they adapting to these changes?
Studies show initial skepticism often gives way to appreciation as providers see how AI can support their work rather than replace it.
Can you give us an example?
Sure, AI helps with scheduling efficiencies and administrative tasks, giving healthcare providers more time to focus on direct patient care.
That makes a lot of sense. Less paperwork, more patient care.
Exactly. And the research shows this leads to higher satisfaction rates among both staff and patients.
What about training? How are healthcare providers learning to work with these new tools?
That's actually one of the current challenges. Studies indicate a need for more comprehensive training programs to help providers effectively integrate AI into their practice.
Interesting. Are there any success stories you can share?
Yes, recent case studies show hospices using AI for symptom tracking have seen significant improvements in patient comfort and reduced emergency hospital visits.
That's really encouraging. What would you say to someone who's skeptical about AI in hospice care?
I'd point to the research showing how AI is enhancing, not replacing, the human element of care. It's about using technology to support and improve the care we provide.
As we wrap up, what's the biggest takeaway you want our listeners to have?
That AI in hospice care isn't about replacing human connection, it's about enhancing our ability to provide compassionate, personalized care when it matters most.
That really brings it full circle. We started talking about technology, but we're ending with human connection.
That's exactly right. And isn't that what good healthcare is all about?
It certainly is. Well, that brings us to the end of today's episode of Copilot Podcasts.
And remember, while AI might be transforming hospice care, it's still the human touch that makes all the difference.
Absolutely. And on that note, thank you for joining us today as we explored this fascinating intersection of technology and compassionate care.
Thank you for having me. It's been a pleasure discussing such an important topic.
And to our listeners, remember, the future of healthcare isn't just about advanced technology. It's about using that technology to enhance our capacity for human connection. Thanks for listening to Copilot Podcasts.